Did ancient cultures understand presbycusis? When we think about ancient cultures, we often wonder how they understood health issues, including hearing loss. One specific type of hearing loss is called presbycusis, which is age-related hearing loss. This condition is characterized by a gradual decline in hearing sensitivity as people grow older. However, ancient cultures did not have the scientific knowledge we have today about presbycusis. While it is likely that people in ancient civilizations noticed that older adults experienced hearing difficulties, there is no evidence that they recognized presbycusis as a distinct medical condition. They may have observed that, as people aged, their ability to hear diminished, but they did not understand the biological causes behind this change. Modern science tells us that presbycusis is primarily caused by the degeneration of hair cells in the cochlea, which is part of the inner ear, along with changes in auditory pathways. This understanding is based on detailed anatomical and physiological knowledge that simply did not exist in ancient times. In historical texts, we find references to hearing problems in the elderly, but these were often explained through non-scientific means. For example, some cultures might have attributed hearing loss to divine influence or general aging, without a clear understanding of the underlying biological processes. Treatments for hearing loss in these societies were typically symbolic or herbal, lacking the scientific basis we relying on today. The term presbycusis itself comes from Greek, meaning old and hearing. This highlights how our modern understanding is rooted in language and concepts developed long after ancient cultures. Today, we know that presbycusis affects high-frequency sounds and is a common condition among older adults. It is irreversible, and while there are ways to manage it, such as through hearing aids or cochlear implants, there is currently no known prevention. This contrast between ancient beliefs and modern understanding is significant. It shows how far we have come in recognizing and addressing hearing health. Understanding presbycusis today involves knowledge of inner ear structures, nerve pathways, and various risk factors. This information has been developed through centuries of medical advancements in fields like audiology and otology. In conclusion, while ancient cultures likely recognized that hearing could decline with age, they did not possess the anatomical or physiological framework to understand presbycusis as we do now. Their observations were based on experience rather than scientific inquiry. Today, we are fortunate to have a much clearer picture of hearing loss and its implications for health as we age. If you have concerns about hearing loss, it is always best to consult a healthcare professional for personalized advice and support.